Day treatment, typically what happens is kids go to an inpatient program, a hospitalization situation, maybe for a week, maybe they've had a suicide attempt. What can happen is they'll go for like a week, and when they're done, if they're just released out to the community, a lot of times they're needing more help than just meeting with a therapist once a week for an hour. A lot of times you'll see these kids have multiple crises throughout the week that are difficult to handle and that can send them spiraling down very quickly back into some of these old patterns of behaviors. And so day treatment and IOP is a nice middle ground for those kinds of kids. The kids coming in, they get this benefit of coming in to treatment during the day, during the school hours, and then they go home in the evenings, and in the mornings they are home with their families. Day treatment also offers some advantages for outpatient, because you have the opportunity for kids to participate in groups, and they get to make friends with their peers, and they'll come in and they'll do a check-in group where they'll say, this is how my night went, this is how my morning went, and they can just kind of give the staff about a quick snapshot of how they're doing and get a little bit of support right there from the beginning. Then there's about 2 hours of school. A lot of times there's a lot of anxiety around school and schoolwork and interactions with a teacher. So maybe there's some oppositional defiance going on with the teacher, or maybe there's anxiety about perfectionism, or how do I deal with my peers, a lot of concentration difficulties. So all these things are happening right there while they are going to school, and we have staff who are there to help them. On one hand, it's designed to help them not get too far behind while they're going into treatment, and their credits can transfer. They can get academic credits towards their school. But I think the bigger piece here is that they are getting kind of this in vivo therapeutic experience of pushing through the difficulties that come up for them when they try to do school. And then the rest of the time is pretty much groups, and they have a variety of groups that they participate in. Dialectical behavioral therapy groups, cognitive behavioral therapy groups. They have expressive arts, play therapy, trauma-focused, behavioral health, which helps them with identity development. Those groups are designed to teach them coping skills for dealing with depression, anxiety, relationships, and all sorts of things like that. So we often do like a rewards activity and an outing where they get to go out to reward them for the hard work that they've done. Teresa, our founder, she's the one who really says, get them out doing things that are just normal, right? It's about getting kids back onto a normal track and just having a time when they can just laugh and be themselves. That is sometimes some of the most therapeutic thing that you can do for them. So that's day treatment. And then IOP, intensive outpatient services, is basically a little mini version of that. And so when they are doing better in day treatment and they're more ready to go back into the school system, then they can step down, so to speak. It's a less intensive level of care. It's from 3 to 6. And so we do a lot of the same kinds of things, and it's usually only 3 to 4 days a week too, providing the level of support that is needed to help them really work through the problems that are fueling these issues, so that they are less likely to return.